Welcome back to Barton Community College EMS education for the EMT student in preparation for the Module 2 exam. In this video, we're going to talk about renal and blood-related emergencies. The renal and blood-related emergencies are encompassing interesting issues that talk about the kidneys and how blood can have a composition that causes issues inside the body. So let's dive in and understand about renal and blood-related emergencies. So in this one, we're going to talk about dialysis, kidney transplants, acute kidney failure, anemia, sickle cell disease, kidney stones, urinary tract infections, hemophilia, and factor V. Now, some of these are kidney-related emergencies. Some of these are blood-related emergencies. But all of these different types of emergencies that we get called for in the EMS field, we need to be ready for a differential diagnosis. Now, there's not going to be a lot that you can do, but we need to be ready to take care of these individuals and provide compassion. So let's get going. Individuals who have kidney failure will eventually require dialysis. As noted in the picture on the lower right-hand side of the screen, we see that they're doing a dialysis treatment. Now, we have the blood that gets pulled out from the individual and goes through the dialyzer or the dialyzer, and the waste is pulled off. We have fresh dialysis fluid that pulls the waste. They work through a chemical reaction. We send the clean blood back into the system because the kidneys are not doing their job. We have kidney failure. So when you have kidney failure, more than likely an individual is going to have to go through dialysis, and sometimes 3 times a week, and it's going to last between 3 to 4 hours a day. And those individuals are going to have a fistula or graft that's put into their arm, and it's going to be a huge bulge. We don't want to take a blood pressure on that side, and the reason being is it's going to affect the vascular network, and we don't want to screw up the vascular network by applying pressure and breaking up that fistula. But if that fistula then ruptures and we have an opening to the outside and we have extensive bleeding, we still need to apply a tourniquet and stop the bleeding because it's a life threat at that moment, and not be so conscientious about maintaining the fistula. We need to save the life, not the fistula. Now, other issues is sometimes people who get put on dialysis also get put on the kidney transplant list. And when a kidney transplant happens, the diseased kidney, or the kidney that is failing, is left in its place as a structural member. And we take the transplanted kidney as to allow for movement and to apply it into the body. We'll place it in the right lower abdominal area or the left lower abdominal area as to allow space, ease of access, as well as in case that diseased kidney has an issue, it's easy to, the new kidney becomes diseased, it's easy to remove that kidney. So kidney transplant, you might see that they have a scar on their front, and that's not from an appendix surgery or an issue with their gallbladder. It may be that they had a transplanted kidney. And so we need to be watching for possibilities of infection in case the body doesn't like the kidney that has been moved into the new body. We have the renal failure, and with acute renal failure, the blood flow is still going to the kidneys. However, we're just not getting the full blood flow that we need. We have inflammation of the vessels. We have drugs that have broken down all the nephers, the little parts and pieces of the kidney that allow for filtration. Or we have a blockage causing a necrotic kidney, causing tissue death, causing infarction. And eventually, if we have lack of blood flow to the kidneys, we're also going to have a lack of flow coming out. And these individuals who are in end-stage renal failure, who are on dialysis, they're not going to pee. They're not going to pee like we expect them to, because the fluid is staying on the inside of their body because the kidney is not able to excrete the fluid. And so they have that buildup of waste, and that's why we have to do dialysis. Anemia. Anemia is the lack of normal amount of red blood cells. The red blood cells, what makes the blood cells red is not only the oxygen on the hemoglobin, but is iron. And acute anemia is sudden blood loss. Chronic anemia comes from excessive menstrual periods, slow gastrointestinal bleeding, or diseases affecting the bone marrow. But we have to understand with anemia that when we have individuals with anemia, we need to make sure that they're staying oxygenated because they have a lack of red blood cells. And so they might have a lower oxygen saturation. They also might have a pale yellowish skin. They might be cold. They might have issues with their heart. They might be tired. They might be fatigued. They might faint easy. What's that word for fainting? Oh yes, syncope. But individuals who are of African American or Indian and Middle Eastern descent can also have another issue that falls under anemia, and that's called sickle cell anemia or sickle cell disease. The reason we call it sickle cell is because the red blood cell basically comes into this concave shape and becomes this oblong, rounded, craziest, weird shape, and we say, whoa, that's defective. That shape looks like a sickle. And when these sickle-shaped red blood cells, they also lack the ability to carry as many oxygen molecules on them because we don't have that nice donut shape that we had before. It also doesn't pass through the arteries and the veins as easily. And so as the picture shows on the lower right-hand corner here, they can become blocked in the normal capillaries, causing obstruction, causing pain, causing blood clots. And so individuals with sickle cell anemia are at risk for blood clots. They're at risk for what we call priapism. Priapism is that erection that can happen. Strokes, acute chest syndrome, so that would fall under ACS, acute coronary syndromes. And it can also destroy the spleen because the spleen helps filter some of the blood, and we can have a splenic rupture or we can have an enlarged spleen. And so all those issues. And so 1 in 12 African Americans have the sickle cell trait. But the sickle cell trait doesn't always lead to complications. Someone can lead a normal life with the sickle cell trait, but when the one time they do, we have issues. So we need to remember to apply oxygen, monitor their respirations, look for hypoperfusion, and then if they are appearing like they're having a stroke, we need to pull that trigger and say, it's a stroke, let's get you to a stroke center and get you that stroke care you need. Individuals who lack in fluids, like we talked about earlier with dehydration, can develop kidney stones, as well as high caffeine intake individuals or individuals that are just genetically predisposed to having kidney stones. And some kidney stones are small enough that you can pass through the ureters to the urethra and pass it out and pee out the kidney stone. And some kidney stones are so big that they have to be surgically removed or ablated and use shock waves to break up the stones so we pee out the rest of the stones. It's extremely painful. Some male individuals have described that kidney stones are very similar to giving birth to a child. Now, how would they know that? I really don't know. But kidney stones are painful, can cause some bleeding coming from the urethra depending on how irregular the shape of the stone is, and depending on where the location is, you know, as it starts to pass, it's going to cause pain, and so they may have pain back here, they may have pain in the lower abdomen, they may have pain in their genital area. But there's so many different shapes of the renal calculi, which we're talking about the stones. And so kidney stones can cause a lot of issues, and we have to understand that in the kidneys, in the renal system, we have 2 kidneys, 2 ureters, and 1 urethra. And it's responsible for filtering the blood and removing waste. But when we have a kidney stone, we might have a blockage, and we might not be able to get rid of the waste. So that could also cause issues, and so it could lead to infection. And so individuals who have kidney stones could lead to an infection. And so we need to understand that it's not just a, you know, you pee it off and you'll be okay. It could get worse. Also, those infections that can happen would be going right along with urinary tract infections. We know we're talking about that urinary tract. It can happen in the bladder, it can happen in the ureters, it can happen in the urethra. But a UTI comes with flank pain, coming back where the kidneys are, high fever, they're sick, they have increased white blood cells, and they could have a bladder infection. And these are more common in females because of the short urethra that females have, but it can still happen in males. So if we see a fever, we see an altered mental status, we have flank pain, they have smelly urine or painful urination, that's indicative that we've got a urinary tract infection going on. And urinary tract infections in the nursing homes is one of the highest incidences of individuals getting sepsis and going into septic shock. So just that little thing getting into the renal system can cause a huge avalanche effect on the body, leading to sepsis. And so as you see here, that the short urethra, we can have that urethral infection, we can have a bladder infection, we can have a ureter infection, or we can have a kidney infection. And all of these come from our urinary tract infections and getting that bacteria in there. And some of that can be from wiping the wrong way, to others just, intercourse, as well as just, they're just genetically predisposed to having urinary tract infections. UTIs in men comes from sex, is one of the biggest indications of someone having a urinary tract infection in men, and only 20% of diagnosed UTIs occur in men, but it can happen. And identifying the fever and thinking that differential diagnosis can be key in helping these individuals with their pain and getting them the proper care that they need. Finally, we talk about two blood disorders here in the end. This is the hematology and the renal system with emergencies happening, and we have hemophilia and we have factor V. Two opposite ends of the spectrum. Hemophilia is a lack of the factor VIII blood control, and there's so many different factors. In the blood, we have all these different factors, and aspirin affects one of those factors, and that's why we don't have blood clotting or creation of blood clots because of aspirin being given. But individuals who are born with hemophilia, there is no cure, but they have to maintain their body because they also will bruise easily, they can have GI hemorrhage, they can have prolonged nosebleeds because their body doesn't want to clot. However, on the flip side, individuals with factor V disorders, they clot so quickly. So your factor V people, they have so much clot that they clot so quickly. You may run on an individual who fell and scraped their knee and was bleeding, and by the time you get there, it looks like they've got a 3-week-old scab on the outside of their knee. It's crazy. But factor V is where the blood clots too quickly. Hemophilia is where the blood doesn't clot. And then individuals who have blood problems can also take blood thinner medication, which causes their blood to become thin. So factor V individuals are going to take blood thinners. Hemophiliacs probably might have to get blood transfusions because they lose blood so quickly. And as you see over here on this picture, there's a picture of the clotting cascade on how it all functions together. And you can see all the different cascade there from factor 1 all the way up to factor 9 and 10 and how it's all connected. And so understanding blood disorders, if we have a hemophiliac, we're going to definitely need to watch maybe any little bleed, because that little bleed could turn into a really profuse bleeding problem. And a factor V issue, we need to be watching for blood clots because that could lead to stroke, it can lead to heart attacks, and so they need to be able to thin the blood. I hope this helps you guys with understanding the issues involved with the emergencies, with renal and blood emergencies, and I hope it prepares you for the upcoming Module 2 exam for the EMT. Good luck, and have a great week.